Micromedex, a free drug reference. Micromedex provides the highest quality of drug information available and is trusted by 3,500 hospitals in 80 countries. The evidence-based drug information is obtained from package inserts, medical journals, and regulatory agencies, such as the FDA. This information is reviewed by more than 90 dedicated physicians, clinical pharmacists, nurses, and medical librarians to ensure the information is correct and current. So why should you use it? I'm sure we all remember the days of carrying around our nursing drug books, usually leaving it behind to later disappear. Today, 85% of nurses in the U.S. are carrying smartphones with work-related apps installed, most often a drug guide. Our phones are smaller and fit discreetly in our pockets, so they're more accessible wherever and whenever we need it. Research shows that having drug reference material installed on a mobile device is critical for reducing adverse drug events. Micromedex pushes updates out to our device monthly, so we have the most up-to-date information when checking our dosages and interactions. And what is great about this app is that it is only $2.99 per year to access information that will keep our patients from becoming one of the 7,000 medication-related deaths in the U.S. this year. So how do you use it? Once downloaded, look for the icon on your screen that looks like this. When opened, a screen will pop up asking you to enter the name of the drug. It's okay if you don't know how to spell it, as it starts to narrow down your selection with the first few letters. By entering the letters AMPI, the medication ampicillin pops up, which is the drug we're using in this example. After selecting it, the recommended pediatric and adult dosing for ampicillin is immediately displayed. I now have the opportunity to look at specific dosing, contraindications and warnings, drug interactions, adverse effects, other names the medication is known for, including generic, and any available clinical teaching. Now that we know how to use it, let's discuss the fine print. The FDA has proposed that with the increased use of healthcare apps, that they be regarded as medical devices and possibly require a medical device certification. All applications that benefit patient care, including Micromedex, should be assessed and approved by your employer to ensure the accuracy of the information. Mobile Micromedex, offered on a smartphone, offers a huge convenience factor in that it is available anywhere there is Wi-Fi or cellular phone service. It offers current drug information that has been reviewed for accuracy by qualified health professionals. Most importantly, it is affordable, only $2.99 per year if your employer does not have a subscription. If your employer subscribes, Mobile Micromedex is completely free. Think about it, that drug reference book we used to carry was approximately $30. The drug information was accurate when published, but may or may not be current today, as dosing and indications do change. Lastly, it was huge to carry around when you could actually find it. Like always, there are some cons to Mobile Micromedex. There are concerns that using a smartphone app may be a barrier between meaningful communication between the patient and the nurse. Sewell and Theed suggest that a nurse explain the use and safety benefits of using that app to the patient to negate any negative perceptions. The use of smartphone to look up medication does pose an infection control risk. It's most likely your personal phone, and you certainly don't want it ruined by cleaning it with the harsh chemicals routinely used in hospitals. Finally, having that smartphone in your pocket increases the temptation to check out Facebook or make a phone call. This, of course, can be done in a lounge or locker room, out of view of your patients. Mobile Micromedex is an inexpensive, reliable, up-to-date drug reference application right at your fingertips. The simple-to-use application gives current dosing, contraindications, drug interactions, generic names, mechanisms of action, pharmacokinetics, administration, monitoring, and even clinical teaching whenever and wherever you need it.